Hello, friends. A very good afternoon to all of you who've joined us for the session today. I'm Himanshu Sharma from Zydus Hospitals. Today, I am going to answer questions which have been asked by many of our patients. Today's session is basically going to focus on three things. First is, a lot of people ask us, is it possible for us to travel to India for medical treatment? We would get into the nitty-gritties of how can this travel be made smoother, and we can assure you of the best services. We'll also talk about the legal processes, and we would also discuss about how can you avail the connectivity from different airports across the world. Our primary focus is going to be the African subcontinent, because it's those patients from Africa who require our services the most. So I would be taking you through a small presentation as I speak to you all. This will help you understand and conceptualize what I am trying to explain. So we'll start with the same. So for all those who wish to travel to India for the medical needs, there are some essentials that we all must be aware of. Obviously, in the times of pandemic, COVID pandemic, a lot has changed. Air travel or getting the visa is not as smooth, or it's not as simple as it used to be before the pandemic. So coming to the next slide. A lot of our patients wonder that, are the skies open? Can we actually travel for medical treatment to India? How will the connections be? Will the flights accept us? So here are some answers which I'm sharing with you to the questions which a lot of our patients ask us. So first of all, there is definitely there have always been some flights, though there were repatriation flights even available during the times of COVID, when the government of India decided to get its citizens and other people stranded outside the country. So flights have always been there. Obviously, the volume has been significantly low because the flyer percentage has reduced. Not many people are taking flights. And definitely there is a fear of the pandemic, which is restricting them. So even today, as we talk, there is definitely limited availability of flights, but it's slowly increasing. More and more number of cities are now being covered by various airlines across the world. Coming specifically to the fact as to there are still some challenges. It's not that it's very smooth, because the occupancy on the flights, there are some restrictions as to how many passengers can they carry. There are cancellations also due to various, like in case they're not able to fill the flights completely, there could be cancellations, and obviously there could also be delays. So before you plan your travel, these are certain things which you must be aware about. The biggest challenge which is faced by our friends traveling from the African subcontinent to India is the Middle Eastern hub connectivity. Most of our patients, most of our guests who seek to travel to India, whether it's from Kenya, whether it's from Tanzania, Uganda, Madagascar, or anywhere else in the East Central or West African region, they usually connect through the Middle Eastern region, that is primarily Dubai. So there are definitely the traffic in Dubai, the air traffic in Dubai is reduced. They're not flying to all the airports, and there are restrictions also in terms of which passengers can they accept, which passengers they cannot accept on the flight. So these are certain challenges which are still prevailing. The ticket cost, due to lower availability of flights, due to low demand, is definitely on the higher side, which is another thing that is crippling to most of our patients who want to travel or seek treatment. Visa restrictions and limitations are also there, which we will discuss about what exactly they are in the current times. But as the time progresses, the visa restrictions are being lowered. The Indian consulates across the world have been very cooperative towards medical travelers who need urgent care. Mind you, it's still important that you will have to uh, get to the consular's office and explain as to why exactly you want to travel. So documentation plays a very, very important role. And friends, one major thing that we all face and we all are scared about is whether I will contract COVID during the travel. So, which is a $1 million question. Airlines say that they are safe. Uh, Probably, and I mean, for the literature that I have read, definitely airlines are relatively safer as compared to crowded places like crowded marketplaces, uh, pubs, bars, or restaurants, wherever we may be going. So compared to that, definitely airlines are safer because they've got efficient filtration systems, and it's mandatory for you to be masked throughout the journey. So these are certain things which make sure that there is a stringent measures which they take to make sure that there is no cross infection. But still, eventually, whatever we may say, there is an inherent fear which exists. Now, coming to the next set of questions is who should travel? Like, is not traveling safer? So we have to choose between the fact that how bad is our health, or how bad is the patient's health, and how quickly or how urgently the treatment is required. This assessment is done technically from two ends. One is the local physician in your country who's managing you would be able to advise on whether this situation or this circumstance or the disease progression that is being exhibited can be managed locally in that country or no. And otherwise, what you can do is also connect to your doctor or your prospective doctor in the hospital where you wish to travel to through telemedicine. So from both the perspectives, there would one thing which will be very, very clear. How urgent is the requirement? Is there a way to delay the travel further in case there is no flight availability, in case there is no means for a patient to travel from, let's say, Ethiopia to India, for example, for namesake? In such cases, the doctor would be able to, the specialist in India would be able to assess and work together with your local physician to manage you efficiently. We at Zydus have been doing these things for many of our patients who are located, especially in places like Nigeria, places like United States, UK. For some reason or other, they've not been able to travel, and obviously the African subcontinent also. So this is one effective way in which we will exactly be able to assess the current condition of the patient and guide further on what should be the roadmap. Friends, the COVID is going to be around, whether we like it, whether we don't like it. There are vaccine trials going on across the world. We are not sure when and how soon are we going to have the vaccine and how the results of the vaccine will be. So there is still a big if, which is there. The many companies are working very, very hard on that, but till the time we have the vaccine available, which would possibly be sure shot, that's what we all pray and we all believe, right? So we have to learn to live with it. For a condition, for a medical condition which is life-threatening, we cannot just wait and perish. There are many such conditions where a patient would need urgent surgery or would need urgent care. Such particular things should definitely be attended to at the earliest without any delays. And Indian councils across the world understand this very, very well, and they help people in getting the visa. Obviously, the documentation requirements are more as compared to what it was earlier, as I mentioned. So we have to take a call whether it's our medical condition that's posing a bigger threat to us or the COVID. We don't even know whether we are actually going to contract COVID or no, but the disease, what we already have, is proven. So friends, Please do not delay your urgent medical treatments. It is very important. You may not perish or you may not die of COVID, but that particular condition, which has been harassing you, which has been bothering you for a long time, can be a cause of fatality. Now, let's discuss that if we know that the only option for us is travel and the solution is not available locally, what do we need to do? In such cases, the most important thing that you will need is to have a clear report from your local doctor before you proceed ahead, mentioning that what exactly is the medical condition and what does it entail? Does it require, let's take an example about cancer. If there is a patient who's suffering from, let's say, a tumor in the intestine somewhere. So such patients would need to have a very clear reporting done from their doctor locally in their own country, who will then advise that, okay, this particular patient would need to travel to India for further management. And the doctor who's going to treat you here in India should also have access to all those reports, because he or she would be required to give you a proper letter indicating the tentative line of treatment, that what would be the treatment plan. So all these things will need to be documented. It is not like earlier when you just mention in the visa letter that a patient wants to just come for cancer evaluation and it will be done. No, the embassy would actually like to understand what is the exact treatment that is planned. So it's very, very important. This would reduce the time that is taken for you to get the visa. This would also help in the understanding for the Indian embassy guys who are working for you as to how critical is your situation. So please make sure that there is a very clear-cut document available highlighting the current medical condition that you are suffering from. Now coming to the visa invitation, the hospital, wherever you wish to go, would have to issue a visa invite letter to you. So the visa invitation letter needs to state that what is the reason for the urgent travel requirement. These, again, friends, these regulations keep on changing. They are under revision frequently. So what I'm telling you right now is what is prevalent today. We don't know, maybe 15 days, a month down the line, things would ease up more. But as of now, these documentations are extremely, extremely necessary. Without that, we'll not be able to move an inch further in getting you a visa. So please insist your hospital to write you a detailed visa invite letter so that you don't have to go again and again to the embassy or face any troubles. A lot of patients who approach us, they ask us that I want to come with 2 caregivers because the patient I'm coming over with is very old, and maybe a lady is accompanying. How would a lady alone manage the patient? So unfortunately, for our betterment, to be honest, the Indian Embassy has a regulation which allows only 1 caregiver. Again, I'm telling you, this is in the current scenario. We don't know that things might change as we go ahead, but as of now, only 1 caregiver is allowed by the Indian Embassy to get the medical attendant visa. So please, friends, do not insist on additional letters, because even if we give you an additional letter for another caregiver, that particular visa may not be granted by the Indian Embassy. So it's very, very important that you understand the reason behind it. We are all talking about physical distancing. And if we ourselves travel with more number of people for treatment, we are actually negating the concept of physical distancing. So please be aware about that. Checklist is extremely important as to what are all the documents that you require to carry for your medical treatment. Obviously, your medical reports, which have been issued by your physician or by any pathology or radiology unit. If you've got your x-rays done, your CT scan done, your MRI done, your blood investigations done, make sure that you have a proper file available with you prior to traveling. All the documents which you have used to seek the visa, a copy of that should definitely be there with you. Any communication pertaining to the treatment plan and the cost, etc., that you have had with your hospital of choice should also be there in that particular file. You should also know whether you are going to stay in the hospital directly, whether you are checking into the hospital directly, or you are going to stay in the hotel. In case you have booked a hotel for yourself, please make sure that you have all reservation details with you. Not necessarily everything should be in hard copy, but it can be in your phone, always available. And make sure that you charge your phone well prior to travel, because again, the moment you're going to use the charging sockets and other things at the airport, you are exposing yourself to probably a threat of COVID virus. Certain important things that we all get to know before you plan to travel to India is that in India, it is extremely important, it is mandatory rather, to have a RT-PCR test for COVID done at least 2 days prior to travel. You also need to check with your airline, your carrier, which is going to exactly tell you, because sometimes the requirements of airlines differ from the requirements of what the destination country has. So please, it is always better to check with your agent or with your airline office as to what is their requirement for RT-PCR. But before landing, you must be negative for COVID infection as per the Indian regulations currently. So please make sure that you have a valid certificate which says that you are COVID negative with an RT-PCR test. Web check-in is very, very important because we are trying to practice physical distancing or social distancing, as we term it as, across the world. So obviously at the airports as well, because they are crowded places. So to avoid queues at the airport, web check-in in many places have been made mandatory. So please make sure you do a web check-in. In case you have any concerns or issues, you should check with the airline or your agent about the same as to whether you can do it in 24 hours before or 48 hours before, because these regulations also vary from airline to airline and from country to country. Goes without saying, mask is very important. So mask, sanitizer, face shield is a must when you are traveling. Avoid taking meals on the aircraft because you'll have to remove your mask. Though if you're thirsty, obviously you'll have to have water. You don't have an option, but please avoid touching any unnecessary surfaces around unless it's really, really required. Though, as many studies exhibit, which I mentioned earlier, that aircrafts are fairly safe because the air that you're breathing on the aircrafts is filtered air. But again, we don't know whether they are non-COVID or they are COVID-free air or no. It's very difficult to say anything regarding that. Prior to arrival in India, you need to be sure that you have a filled self-declaration form, and you should also retain a copy of the same. So that self-declaration form, I will share the link after I finish this session. You can see it on our social media handles. So in case you need to download or go through it, you will very easily be able to go through the same. So that's basically a declaration form that's going to tell that why you are traveling, what is the purpose, where are you going to stay, which is your final destination as to you're going to seek treatment at, and the contact details. In that case, if you don't have contact details of your own that you can share, you can put in the contact details of the hospital or the hotel where you're going to stay. Right? There are a lot of people who have been asking me if we can come over for medical checkups. Yes, you can travel for medical checkups also. That is, but for that also you will need a medical visa and not a tourist visa. Though many countries have started accepting Indian tourists, as well as India is accepting tourists from outside. But for any medical purpose, it's a humble request. Please, please, please only take medical visa, because it makes a lot of sense to have a medical visa when you are coming here for any kind of a treatment or any kind of an assessment. So you can still be a tourist, right? You can still go around and see places when you're around, in case you feel that you're confident and secure enough to do that. But please make sure you have medical visa for the hospitals to attend to you in a more efficient manner. Any document that you are carrying, you don't need to have the hard copies with you all the time, because that obviously is going to entail more touch. And we are trying to ensure that we do not touch many things around us in order to restrict any possibility of infection. So please make sure that you have soft copies in your phone, maybe in a PDF form, in a single file, ideally, which is not very difficult. You have applications available which for the phones, which can convert any of your document into PDFs. So make sure you have it available in your phone all the time, in case airport authorities or airline need to check any of your documents. They will be happy to just check it on your phone rather than physically checking those documents. In India, as you arrive, you will also need to have the Arogya Setu application. This is basically a tracking mechanism by Government of India as to where all are you going, or where all our patients are going to go. So this is just to make sure it's for your own safety, that in case you are in an area where there is a high prevalence of COVID, they'll be able to forewarn you and you will be protected. So it's for your benefit. For that application also, I will share the details in our social media when I post the story on the social media pages, right? So coming to next now, travel options. This has been quite a dicey situation for all of us, for our patients, for the hospital as well, everywhere. Now, finally, we have some scheduled flights. It means these are the flights that are flying as per their fixed schedule. These are not repatriation flights. These are flights which are available to the tourists, our patients, whoever wants to travel. So I'll start with Tanzania because we have a very personal and close relation with Tanzania. I personally have. So Air Tanzania is apparently one of the first scheduled carriers which has started to flying to Mumbai from Dar es Salaam on a bi-weekly basis. So our guests or our patients can very easily get tickets on Air Tanzania. You can inquire either with your local agent or you can check on the website of Air Tanzania Corporation. We have another set of weekly flights between Nairobi and Mumbai. Obviously, East Africa has a very strong connect with India, and a lot of people travel to India for medical treatments and more from the East African region. So we have KQ, Kenya Airways, which is again flying on a weekly basis, and Air India. As of now, they are flying twice a week. We hope that the frequency increases and we have more flights between these two cities. Coming to our major hub in Middle East, which is Dubai, which connects the world to most of the other cities of, whether you talk about Asia, you talk about Europe, you talk about Middle East, it's one of the most important hubs. So Dubai Ahmedabad flights are available. You have Emirates and Fly Dubai, which are flying regularly. When I say regularly, I mean to say maybe once or twice a week. Still, the schedule is not available to me as I'm presenting this session to you. Sharjah Ahmedabad Air Arabia is also available. Both these, I mean, all the three airlines, that's Emirates, Fly Dubai, and Air Arabia, have certain limitations. So when you are traveling into India through these flights, it's all the way probably you are traveling with Air India or KQ or Air Tanzania. But when you are going back from India, as per the regulations of UAE, you might be required to break your journey for a day and acquire a local visa there, right? So these are certain things that you should check with your agent prior to booking so that you don't have last minute surprises. Again, friends, this information, what I'm sharing with you is as of what I'm aware today. These regulations keep changing frequently, so your agent or the website of these airlines would be the best place to get guidance on the same. Each airline has their own set of regulations, so please go through them very diligently. Please do not miss on anything. Ask your agents as many questions as you wish to. Read through the documents which are available and stay updated. Now, another very important aspect which probably is not mentioned right now here, is how about flying fitness? Flying fitness is the same as it used to be. You will need to have, if your airline or if your agent wants that the airline is requesting for a fit to fly certificate, your hospital will be able to provide it. When you are traveling back on the onward journey, the same will have to be done by a doctor who's treating you. So please check that with your airline at your uh, port of departure, and they will be able to guide you further on the same. But this is very important because after reaching the airport, if you do not have a fitness certificate or if the airline has a requirement that you need to have a fitness form to be filled prior to the flight, then you are going to be in a soup. So avoid those surprises and check whether you need to have the MEDIF form, which is technically called, filled, because each airline will have a different regulation pertaining to that. Now, friends, this is equally important to everyone who wishes to travel to Zydus Hospitals, Ahmedabad, for treatment. Though patients have trusted us a lot over the years, and even today, during the pandemic, we take pride in the fact that we have treated over 35 international patients from different parts of the world during the COVID pandemic. That is, since the COVID pandemic started. So we are a non-COVID hospital, that is a COVID safe hospital. We don't admit COVID patients. We take all the precautions necessary for making sure that our patients are safe. The hygiene levels are very, very high, and they are adhered to. The regulations are adhered to very, very stringently. Just in case there is a patient who walks in to the hospital into, let's say, emergency and turns out to be COVID positive, we have advanced isolation facilities available. So such patients are given treatment, not denied treatment. They are stabilized, and then they can be shifted to a facility that is COVID facility. There is a personalized care which we are known for. Zydus Hospitals is known for personalized care to each of its patients who come over, especially our friends from East Africa who have experienced our hospitality. I'm using the word hospitality because it's technically hospitality, would be able to vouch for what I'm saying. So that stays the way it is, the way it was prior to COVID, the same levels of efficiency, the same levels, the same standards of care still continue to be there. Obviously, there would be much more precautions which are taken, keeping in mind that we don't want our patients to get infected while they are getting treated with us or while they are traveling back home. So all the necessary precautions are taken. We advise our patients individually according to their susceptibility. So if a patient is coming for any kind of a treatment, they can be rest assured that Zydus Hospitals is a safe place for them. So as we come to the end of this presentation today, I welcome my patients, our patients, Karibu to all those who want to come over for treatment to us. We are ever willing to assist you with whatever we can at any given point in time. And be assured, we are with you and we are going to be with you. So friends, that is all that I had to share with you. This particular presentation of mine is going to be available to you on all social media handles of Zydus Hospitals. Please do go through them. In case you have any questions, any queries, please do write to us. We'll be more than happy to assist you, keep you informed, keep you updated about whatever is happening pertaining to safe travel to India. At last, I'm grateful to all those who have trusted us during the pandemic, traveled all the way from Africa, from UK, from Japan, and many other places, who have sought treatment and returned back home healthy. So please take care of yourselves. And I wish you all the Indian festivals of light. Happy Diwali to each one of my friends across the world. Thank you very much. Namaste. Asante Sana.